and then we'll open it up for some questions.
A member of our audience would like to say that that keeping the baby skin to skin while doing a glucose check is important for comfort and pain relief. So just seconding what Stephanie's already said. First question, what is Sweet Ease?
Alrighty, Sweet Ease is a sucrose. It's a little, it comes in like a little bullet package, or it can come in a little cup, and it's given to the baby. It has an opioid toward effect at reducing pain in the infant when we're doing a procedure, an invasive procedure on them. So it's I guess I shouldn't have added that in there. It's a brand name of a sucrose that's given to infants during the procedure to help with the pain.
Thank you. What contributes to intrauterine growth restriction?
So the slide, let me see. Preeclampsia and the vasculopathy. So the infant is not getting as much blood flow to the placenta, to the infant, due to the constricted blood vessels, and so therefore not getting all of the nutrients that's needed to grow. And so those infants are usually the ones that are a lot of times preterm, because if they're not growing, they're not getting those nutrients, they need to get them out of there.
Thank you. Should it be routine then to order calcium and magnesium levels on all infants of diabetic mothers?
That is a really good question. I'm used to working in the NICU, so I'm like pro, labs and all that stuff. I think if they're doing fine, they're in the regular newborn nursery, everything's going well. In my opinion, that's not necessarily, necessary to do that invasive test on them. But, it's always worth an ask to, if you're working in the intermediate care or the infant comes in and they're having other issues, I wouldn't imagine that it would be totally out of line to ask if they're already drawing other labs to, throw in a chem panel or something on top of it.
Okay, thank you. Oh, wait. I've got a couple of questions that didn't make the list. Can you tell me what the acronym RSV stands for?
Okay, RSV is, I hope I'm saying this right, respiratory syncytial virus, and it is usually in newborns, and it's like it's an infection, almost like a pneumonia type of thing, and so it would be, something that would be diagnosed either in the hospital or out in the outpatient areas.
Okay, thank you. What is the name of the globulin for immunity that adheres to the gut lining? You mentioned it and I missed it.
Okay, so the immune globulin is called secretory immune globulin A. And this is the immune globulin that's, again, only found in breast milk and is in higher levels in the colostrum.
Thank you. Due to dental concerns, should pregnant moms have their teeth cleaned more frequently while they're pregnant?
I don't know. I've heard both ways on this, and I'm definitely not the expert here. This is just my opinion, but I've heard that women should go to the dentist early in pregnancy if they are going to be, doing that. I've heard that women should not go to the dentist during pregnancy, so I will try to get maybe a research article or something that we can post online in regards to this. But I think, the most important thing is just stressing the dental hygiene and drinking lots of milk if they're not lactose intolerant to get in that calcium, because the baby is robbing the mother of her calcium, and of course that's stripped from the bones and the teeth.
Okay, thank you. Is tight glucose control and A1C less than 6 a goal for moms? I am seeing this is no longer the case in general populations. Is that another one of those we need to research and get back?
I think so. I mean, of course, we can see here how important glucose control is. How strict they want to be, again, is up to the policy, up to the physician. But definitely to have it in control is, I would imagine, a goal of everybody, because we can see what happens when it's not under control.
Okay. Let's see. What about feeding term LPT before checking glucose levels?
If it's like a lot of hospitals and it's a nice term infant, they're not showing any signs of respiratory distress, they're probably going to be getting them skin to skin immediately with the mom, and I would encourage them to do the breastfeeding if it's a good-looking baby. And then, of course, if you've got them right on up there, keep them on mom while you're doing your levels, or if it's your policy to have the infant be examined after that initial skin-to-skin contact, to do the check at that time.
Okay. Let's see. Do you know why the breastfeeding reduces the risk of SIDS?
Why breastfeeding does?
Yeah.
Um, I will get back. I will post something online on the exact details of it, just because that will be able to explain so much better than I can.
Okay. Okay, that was our last question. So I would like to remind everybody about emailing me if you are in a group situation and you're listening as a group. The sooner the better. That just means the sooner I get them, the sooner you get your CEUs. Please do your evaluations. Our next webinar is going to be Wednesday, April 30th. We are going to have Geeta Rao, who is one of our old regional Sweet Success dietitians, and she'll be talking to postpartum nutrition care and more information on breastfeeding. So with that, we will sign off. Look for our emails and links. We will be posting any questions that we didn't get to online. Thanks, everybody, and we'll talk again next month.